Nigeria continues to face rising cases of mental health condition. It is more worrying that a lot of people who come down with this condition are not getting the needed care. Uduak Obom Akchibom in this report highlight diagnosis and treatment options for mental disorder.
Mental health is said to be the mother of all health, and when there is a breakdown arising from a combination of biological, psychological, and social factors, it can be challenging.
For many years, I've been taking drugs. I don't even know what is happening. Be in the street, one place to another, cannot even eat, till on a very good day. And I give thanks to God today.
While this Nigerian may have escaped the claws of mental disorder, a lot of others are still battling and subjected to different treatments and management options.
Depression, anxiety disorders, and then what we call the bipolar affective disorders. And then you also have what is called schizophrenia, which is actually the worst mental illness. So these are actually some of the diagnoses that people, that experts will arrive at. There is a form of treatment that may be peculiar to mental illnesses that we call, electroconvulsive therapy. And then you have things we call psychotherapy, and so on and so forth.
The cause varies. It depends on the different diagnosis, it depends on the presentation, and that would depend on what the person will take. It is not just a one box fit all.
It is observed that many Nigerians, drawn by cultural beliefs, see spiritual and traditional alternatives as better approaches to treatment. But psychiatrists have their take on this.
For us, our emphasis is that take your tablets. Any other thing that we don't believe will harm you, that is a vital component of your culture, your religion, your spirituality, and otherwise, will give you liberty to also exploit. While we are giving you medicine, tablets, injection, psychotherapy, and whatever other treatment modality.
Mental health condition comes with public expectations. Edo State government seeks to domesticate the national mental health policy and other initiatives.
At the primary healthcare level currently, we do not have mental health services there. So what we are planning to do is to integrate mental health into primary healthcare delivery so that our people will be able to access mental health care.
On the other hand, private and NGO-led support is also driving the effort for mental wholeness, while more awareness, education and early intervention are described as key.
Ours now, we're only known for rehabilitation, drug and alcohol, but we're doing advocacy more than the rehabilitation we are known for. Advocacy is very, very important. The coordination from government, NGO, and also to the medical aspect, Nigerian Medical Association. Bring them together, let them talk about it, we'll get results.
Experts say medical health condition is a social issue and as such should be handled properly and given the needed support, while efforts should not be spared to provide access to care for people with this condition.